Hello, everybody. Thank you for tuning in to My Doctor Doesn't Listen to Me. This is a series that's really aimed at dissecting out some of the issues we have in American healthcare, specifically the relationship and the healthcare experience between the physician or the provider and the patient. My name's Andy McDermott. I am a board certified family medicine physician and have been practicing family medicine since 2013. I absolutely love my job. I love working with patients and I love the healthcare experience and the bond I'm able to create with my patients. And that is largely what is at the heart of this particular series is trying to tackle why the number one complaint I get from my patients is very simply my doctor doesn't listen to me. These upcoming episodes are going to attempt to tease out some of the reasons as to why the healthcare experience has seemingly deteriorated over the years and become downright combative at times. This is a very real and I think necessary conversation for us to have both from the physician standpoint and the patient standpoint. I still laugh at how the concept for this series came about. It all stems back to when I got accepted into medical school, and I remember my mom coming up to me and showering me with hugs and just very, very excited, as was I at the time. And like a light bulb, she stopped and she said, "Andy, if you don't listen to your patients, I will effing punch you in the face." I may or may not be exaggerating with some of the expletives at that time. Probably not. I think that's probably precisely what she said. But that comment made a very lasting impact on me. And to this day continues to be something that I revert back to and I think about frequently because I think it's so important as to how the relationship between the patient and the physician is formed. I come from a family that's full of nurses, and that's probably what attracted me to the medical field in the first place. What I've learned about nursing through just growing up as well as working with nurses throughout my career is that they are extremely talented at being able to create clear communication fields with patients and establish a very, very productive relationship with the patient. This is precisely where we as providers seem to struggle, and I think we can learn a lot from the nursing industry. I will say that I have the utmost respect for nurses. Furthermore, I'm married to a nurse who is the most incredible woman I've ever met that I'm madly in love with. We have three beautiful children together, and we actually met delivering babies together. It's safe to say that the healthcare experience touches everybody pretty significantly. Go to any family event any time of the year, and I can almost guarantee that someone will discuss their healthcare, their medical conditions, and their experiences with the rest of the family. And it's at those type of events where you'll hear folks talk about what a bad experience I had and a lasting impression, which is exactly the opposite of what we want to leave with folks. And they'll talk about specifically what it is that was a barrier between them and the healthcare team. I hope that this series is able to tackle some of those obviously very important topics and very important barriers so that we can start to repair and potentially improve our industry and the way we do things. So again, this series, despite the title, My Doctor Doesn't Listen to Me, is not meant at all to be a doctor trashing event. It's really quite the opposite. This is really meant to just be, I thought maybe a catchy title that got folks talking. But with that, I do think it's important that for as much as you can, that there's some ground rules that are laid down in terms of what we're going to chat about, and understanding that this is a very complex situation that requires a lot of these layers of the onion to be peeled back before we can get to the heart of it. Ground rule number one is to make sure we're avoiding getting into the blame game. When it comes down to it, really, no one's to blame. Everyone's to blame, however you want to look at it. But focusing on blame is not going to be productive and not going to get us any better towards repairing the relationship. It's important to tease out some of the issues that have gotten us here, but to focus on who's to blame is really irrelevant at this point. Rule number 2 is to acknowledge that just as patients go to the doctor's office and have no intention of being hurt, the healthcare workers don't go to work every day with the intention of trying to hurt patients. I realize this is a very simplistic idea, but it's inherent that we respect that as we try to tease out some of the barriers in the healthcare experience. The last rule is very simplistic and humanistic. Safe to say that the healthcare experience is extraordinarily vulnerable for both patients and healthcare providers. If in this vulnerable time, we as people are not able to set aside our divisiveness, then the conversations we're having today and beyond are completely irrelevant. So there you have it. That's the end of episode 1, which is building the concepts and the background information for this series, My Doctor Doesn't Listen to Me. Please hit that subscribe button below and be on the lookout for some of the future episodes that we have coming up here shortly. Again, my name's Andy McDermott, and thank you so much for tuning in. Again, hit that subscribe button below.